Do you find, Tom, that it decreases the amount of time with the patient surgically, their procedure, and how easy is it to manipulate and use in the procedure?
I've been using this for about close to a year now. It's come out, around that time. So I've had a chance to use it in a multiple amount of cases, different forefoot to hindfoot ankle cases. I think it's very well engineered. So it's a very simple way to slide the tray in and out. It's a 90-degree locking position, so it kind of simulates that 90 degrees. Usually the knee is positioned with some slight flexion, so you have a little less soft tissue tension there, so it's ideal. And then you can engage that to a 90-degree foot plate, and it engages a simulated weight bearing position pretty easily. And then you can unhook it if you want to get that out of the way. What I've done at times is I've used it to hold the position, and then for first MP fusion, for example, I can look at the position very easily, and then I can just leave it there and apply my fixation. Temporary is already applied because I'm checking the position. But you can do the whole thing with the weight bearer there, retract the soft tissues, and temporarily and permanently fixate with the foot in that same position. So that really gives you the best way to be sure that you're capturing the position you want for your fusion. I've done that with hindfoot cases with double, triple fusions where I have, the ability to have the foot kind of held. I can see the position I want, I can temporarily fixate, and then I can double check everything carefully, and then I can apply the final fixation. So it has that capability. I think for me, I feel that I can't tell you how much time it saves me, but I just know that the time I spend in the OR is based on the fact that I need to make sure the position is right. It's worth spending the time. So now, if I have a device that I feel is reproducibly able to load and allow me to evaluate the position carefully and accurately, then it gets me to my ultimate goal of finishing the case quicker. So it's just useful. It's useful for me to know that I'm ready to fixate and I'm ready to move forward, because I've confirmed the position is appropriate. So that's why it helps me in the way that it does. And then I would just say that when I first used it, the first thing that the scrub tech said is that they just love the fact that they don't even have to hold anything.
Mm,
It's kind of funny. No one wants to be holding the foot or ankle at any time when there's X-ray exposure. Now,
mhm,
we've been doing it for 35 years, but you know, I think we just do it because that's what we were trained to do. I did as a resident. I held every flat plate for my attendings because that was the resident's job. And and now with and without residents, I still hold it because I want to make sure the position's good. So if the position is confirmed to me reproducibly with this device, I just have one less thing to think about.
mhm.
And for me, I know that getting away from the X-ray exposure is just going to be healthier in any situation.